Welcome to Heartbeat Pueblo, a show for Pueblo, about Pueblo. Every week we'll discuss a variety of topics that affect Pueblo County residents. Heartbeat Pueblo is brought to you by American Medical Response. There when you need us.
Good morning. Welcome to Heartbeat Pueblo. My name is Chris McMahon, paramedic with American Medical Response, and each week we bring great guests and have some great topics. And this week my guest is Dr. Greidanus with Parkview Hospital and quite a few organizations that I've seen you with over the years. We've known each other we were just discussing about a decade. How are you this morning, Tom?
I'm doing well, Chris. Thank you.
With a lot of changes in healthcare and a lot of things that have been coming about with Obamacare and with the way people view healthcare, you guys ran into some stumbling blocks that you discovered talking to patients and trying to educate patients on their own healthcare. And you're a very good associate with another friend of mine, Dr. Sean Gogarty, who also is a Parkview ER doc, and you guys found a need. Before we talk about that, tell us a little bit about you. Where did you come from? You're not a Pueblo native, is that correct?
No, actually, born in Detroit, raised in Canada, Edmonton, Alberta. Did my college up there at King's College and University of Alberta. As a dual citizen, I came back to this country for medical school in Philadelphia and did a residency in emergency medicine at University of Michigan. I went to medical school on a Army scholarship, U.S. Army scholarship, and ended up being stationed in Hawaii, Korea, and then 2 years here at Fort Carson. And I kind of fell in love with the area and the lifestyle and the climate and ended up sticking around. That was over 10 years ago.
Well, I definitely thank you for your service. It's great that you were serving your country and providing medical care, and then falling in love with Colorado is not a hard thing to do. We love the Front Range, and there's some beautiful areas around here. The company that you guys started is called Incendant. Tell us what sparked that desire to create this company, where the need came from, and then what it does to fill that need.
Dr. Gogarty is a former educator, a high school math teacher actually, before going to medical school. And so he has a passion for teaching, and was quite frustrated one shift that he had patients that couldn't understand what he was trying to say, despite his best intent. And he spends a lot of time at the bedside, and he's doodling and drawing, and patients didn't get it. He came out of a room one day and said, "Tom, there's got to be a better way. There's got to be a way we can use technology to improve understanding." That was kind of the spark that started the company. Sean and myself and a partner, Joe Hunt, who has a production company in LA, formed Incendant. And what we do, we're a patient engagement company. We make very simple, easy to understand videos that meet patients where they are so they understand. And what we found is they're happier, healthier, and they have better outcomes.
Talking about gaps in communication and understanding when you're a patient, when you come into the emergency room, even as a medical professional, and there's a lot that I understand, but there's certain things that it just kind of goes over my head when I'm hearing certain lab values or certain specialty things. And what kind of problems did you run into with communication, and how was the patient inhibited by those communication problems?
The more we looked into health literacy, we realized what a huge problem it is. Commonly, we talk about patients understanding at a 6th grade level. It's actually closer to a 4th grade level. There's also the barriers of being sick and getting medicine, and the chaos of the emergency department. It's not a good time to learn. Looking into the literature, we realize that there is a solution. We can use images for one thing. Images increase learning up to 400%. And they're actually processed 60,000 times faster than text, which is pretty amazing. And videos increase engagement by 180%. And I really notice that when I turn on a video to educate a patient in the emergency department, they focus. They sit on the edge of the bed, and they are 100% engaged for the 2 to 3 minutes of that video. They really get it. The most common response I get after showing a video is, "Thank you," or "I get it."
Being a healthcare provider and talking to patients and asking questions about their medical problems, that's one thing that helps me as an educated patient, when they know what their medical problems are. And when we respond to an emergency situation, just as you said, people who are sick, injured, they're not thinking quite right, and they may present that information incorrectly. But if they don't understand the situation at all, it definitely creates a communication barrier and can inhibit patient care, trying to figure out what their medical history is, what their problems are. We are trained, we look at medications, we look at everything that we can find on the scene, and then we try to bring that to you, which you guys don't even have the privilege of being in the house, in the living room, on the scene of that accident, trying to figure out how do I care for this patient when with somebody with a medical history that we need to know and understand impacts how we treat that patient in that acute situations. Again, learning learning how to educate our patients and taking on the responsibility for the listeners out there. Really, you guys need to be involved with your own care and ask your doctors questions, ask your healthcare providers questions. And this is a great tool because we live in the modern society where technology is key. Everybody has a television, most everybody has a computer, and a lot of us carry them in the palm of our hands with our cell phones. So you guys are kind of bridging that gap between communication face-to-face and the technology that people seem to really enjoy and can focus on better, and that's awesome.
That was very well said, Chris. I totally agree. That acute episode of illness is not a great time for communication, and that's why we focus on patient engagement. Just to explain to listeners what patient engagement is, in the last 2 years, there's over 100 studies that show those that are active participants in their healthcare have better outcomes. And so there's two pieces to patient engagement. That's the patient working with the clinician to collaborate to find the destination, where are they going and how are we getting there. So basically shared decision making and agreed upon health goals. So if you have a chronic illness such as COPD, how am I managing that, and what's my destination for my health care?
And understanding as a patient what your medical problems are. I can say from my own experience asking a patient, do you have COPD, using your example? And they're like, oh no, well, you're on oxygen and you have a nebulizer. Well, I have emphysema. Well, emphysema is a form of COPD, but because of their lack of knowledge of their own illness, they don't understand when we ask certain questions that does tie together. And then understanding how their actions and their own care and providing for themselves through their physician or their clinician and provider will impact their care in an acute situation. Really some great information. We're going to talk more in depth about patient engagement and how your company and your product has bridged that gap between communication from a provider and the patient when we come back. This is Heartbeat Pueblo. We'll be right back.
Auto accidents, chest pain, stroke symptoms, any medical emergency, your friends at American Medical Response are there to help 24 hours a day, 7 days a week. AMR provides emergent and non-emergent medical transport for Pueblo County, and all of southern Colorado. If you have an emergency, call 911. If you have questions, call AMR's dispatch at 545-9631. American Medical Response, there when you need us.
Sangre de Cristo Hospice is here to share the journey.
We're making it count, making the most, making a difference with our lives, giving our hearts, giving our souls, giving ourselves and taking time to be somebody's miracle. With every day we're learning, life's all about sharing the journey. With our lives.
Sangre de Cristo Hospice and Palliative Care, with 5 locations in southern Colorado. It's all about sharing the journey. Visit socohospice.org.
All about sharing the journey.
Welcome back to Heartbeat Pueblo. My name's Chris McMahon, paramedic with American Medical Response. And by the way, we're really glad to be on more stations, 100.3 FM as well as 93.9 FM. And if you're listening to AM radio, 690 AM, all up and down the Front Range. So it's great to have you guys. Also check us out on Facebook. Search out Heartbeat Pueblo on Facebook and like us. You'll get updates as to who our guests are and what our topics are. And this week we're talking to Dr Greidanus, who is a Parkview ER doc and gentleman that I met years ago through Parkview Hospital, and we sat on some committees together. And this morning we're talking about Incendant and a program that you and Sean Gogarty have put together about patient engagement and being able to educate patients thoroughly on what their conditions are and how to understand what is going on with them as a patient. Also, there's been so many changes in healthcare across the nation. We've all heard about Obamacare, and everybody's struggled with trying to find insurance and things like that. The healthcare reimbursement scene has changed a lot, and it really is going to benefit the patient because it's changing to more of a value-based, outcome-based result, which really is going to help our patient care and make the patient better off once they leave their doctor's office, the emergency room, the hospital. But they, again, still need to understand things. What does this value-based approach that we're looking at with healthcare.
It used to be that regardless of how many visits you have to the ER, to the hospital, you got paid for those visits, and it was more of a episodic care rather than outcome-based reimbursement. There's a New England Journal of Medicine article from 2011 that highlighted that 20% of Medicare patients are readmitted within 30 days to the hospital, and that in and of itself is a $17 billion a year problem. So readmissions is a huge problem. Realizing that things had to change, there's now reimbursement that's called value-based purchasing, more commonly known as pay-for-performance. The reason that's come to the forefront is because the trajectory of health spending is not sustainable. The importance of transitional care and poor health literacy and outcomes has come to the forefront with this. Hospitals are now penalized for readmissions and for poor performance indicators. So hospitals are struggling to find a solution, and we developed a product that can be that solution.
Tell us a little bit more about this performance-based, and you said that hospitals can be penalized for readmissions.
Yeah.
Give us a little bit more of a
Detail
description about that. Yeah.
Sure. So in general, CMS payments, which is Center for Medicare and Medicaid Services, is the lion's share of reimbursement for hospitals. It actually is around 43% of hospital revenue, so it's huge. With this new pay-for-performance, 5 to 10% of total Medicare payments are at risk by 2017. This initiative just started in last year, 2013. It's going to increase, and there's going to be losers and winners, but the reimbursement pie is not going to get any bigger. It's just going to be shared differently. So for most hospitals, this means millions of dollars lost or gained per year. Considering that, there's been a lot of recent news about patient engagement and that it's a blockbuster drug. There's some great Kaiser studies showing that huge improvements in outcomes by having patients engaged, which means focused and working together with the clinician for their healthcare outcomes.
So with the patient engagement, there's going to be responsibilities, I would think, on both sides, as the healthcare provider as well as the patient. The healthcare provider giving the information, educating the patient on what their conditions are, as well as proper care, designing a good care program, a good path for care so that they don't return to the hospital, especially with the same type of ailment. That's one of the keys, is to minimize readmissions for the same ailment. It doesn't necessarily penalize if a patient comes up with a new problem. If you have somebody that you treated for a heart attack and 6 months later they have a stroke, or a month later they have a stroke, that doesn't correlate into penalties. Readmissions or continued problems with the same type of condition is key. I think this program utilizes things that modern technology that people can relate to, that people are used to. To educate themselves is key. You need to be responsible for your own health care, and that you want your healthcare provider to offer this education. Is this something that you guys are state-of-the-art on, or are there other organizations around the nation that are getting involved?
There's other companies that do video education. There's just no one else that does it as simple as us. We make it really meet the patients where they are. That's our focus. That's our niche, and we do it in a unique way. I'll give you an example of COPD. That's one of the major problems of this country. Even though smoking rates are decreasing, it's the legacy of smoking, and COPD has a huge impact on this country, and that's one of those frequently readmitted problems. So we have a curriculum, basically a curriculum or a care path that patients watch, that they can watch at home, and that the home care nurses can actually use in the home to teach patients how to have better outcomes and how to take care of themselves. We had a recent example through Parkview Home Care where a patient had been readmitted several times in a couple months for COPD, and you may have transported that patient at some point.
There's a possibility.
Anyways, was on this care path in the home with the home care nurse. They use tablets like iPads, and they show them these videos. And we have medication videos, and there's one on how to use your inhaler. And the patient stopped in the middle of the video and said, "That's not how I'm using my inhaler." That was the simple little thing. They weren't taking their medications correctly, and we all pay the cost of those increased healthcare costs for these readmissions because there was poor understanding. So that's a good example of what patient engagement can do.
And we run into that on the ambulance quite a bit, especially with COPD. We have a lot of diabetics in this community that they really don't understand what their medication does, how they're supposed to take it, and then we end up in an emergency situation because of lack of knowledge of the patient. And that also then falls back onto educating responsibilities of the healthcare providers to make sure that their patients understand and know what their conditions are and how they're supposed to take their medication. We have so many patients, you hear stories of Parkview and St. Mary Corwin, both hospitals just getting overwhelmed. It's flu season. Everybody's busy. And you see all of these patients coming through, and we're transporting hundreds of patients a month, thousands of patients a month. So the volume of patients can make it very difficult to pass that information on without having a good set structure of how to give that information. And I think this program is a good example of how to utilize a tool that gives a set, consistent format of education so that that patient walks out with all the information they need. Great service that you guys are starting to provide. One last question about Incendant that I'd like to ask. It's not just at the emergency room that they see these videos. How can they access these videos if they haven't made an emergency room visit, but they're listening here? They're going, wow, maybe I don't understand my medical condition as well as I should.
We sell to hospitals as well as to urgent cares and to home cares and hospice. So we have multiple markets, and that's those clinicians then use our videos as an education tool. Many in the community here that are listeners may have access through home care.
You mentioned hospice, another great entity here in the community. They do provide a tremendous amount of service, far beyond even end-of-life services. They do so much in so many different ways to aid somebody who has a life-changing illness. And again, it's one of those things, I can't stress this enough. Listeners, you've got to take your responsibility in your own health care. The doctors are there to provide care, and they have the tools and the technology and read the labs, and they look at the EKGs, and they look at all of these different evaluation tools to find out what is wrong. But you need to be responsible in your own health care and to communicate back all of the conditions that you have, all of the signs and symptoms that you have, and then take the responsibility to learn about your medications, to learn about how to administer medications, take medications, what signs and symptoms require an emergency room visit, what signs and symptoms require maybe just calling your primary health care provider for some additional information so that you maximize your potential outcome. Everybody needs to be responsible in this situation, but who is ultimately responsible for your own health? That is you as the patient, you as the one who is ailing from that disorder. Well, we're going to talk about a few more things and how Tom and Sean, and through this program, have become involved with the community here in Pueblo. This is Heartbeat Pueblo. We'll be right back.
American Medical Response has been proudly providing ambulance services to Pueblo community for more than 17 years.
As a part of this community, we offer the assurance of respect, compassion, and dignity for every patient that we treat.
Our dedicated employees who live and work in this community are committed to providing the highest quality emergency medical services.
24 hours a day, 7 days a week, AMR is ready to serve.
When seconds count,
You can count on us.
Sangre de Cristo Hospice is here to share the journey.
We're making it count, making the most, making a difference with our lives. Giving our hearts, giving our souls, giving ourselves and taking time to be somebody's miracle. 'Cause every day we're learning, life's all about sharing the journey. We're making it count, making the most, making a difference with our lives.
Sangre de Cristo Hospice and Palliative Care, with 5 locations in southern Colorado. It's all about sharing the journey. Visit socohospice.org.
All about sharing the journey.
Welcome back to Heartbeat Pueblo. My name is Chris McMahon, paramedic with American Medical Response, and I'm talking to Dr. Tom Greidanus, who is an emergency room physician, but you do a lot of different things with the community, and we've been talking about Incendant, a company that you and Dr. Sean Gogarty have put together for educating patients. Before we went to break, I mentioned you're involved with hospice. Talk about hospice and all of the other things that you guys are involved with the Pueblo community.
Sure, love to do that, Chris. Sangre de Cristo Hospice is using our product Hospice is a really difficult topic to discuss. End-of-life care in general is difficult. It's you had mentioned it's not just end-of-life, it's also all the other serious illness. There's advanced illness management that Sangre de Cristo Hospice is involved with, and palliative medicine as well. So we have some videos that are used by them in the home as well as in a hospice house by their clinicians to educate on symptom relief, pain, and advanced directives, and help talk through some of those very difficult topics.
Advanced directives is one thing that you never want to plan for somebody to die. It's kind of like life insurance. Why do I need life insurance? I'm young and I'm healthy. Well, tragedies happen, but then as you advance in age and things develop medically, that some are avoidable. We mentioned smoking. We want to minimize the risk, but there are certain diseases that we just cannot totally prevent. You need to think ahead with advanced directives. How do I take care of my family in the event that I'm not around, so that I can give my wishes and make my wishes known to the family? And those are little things once you tackle them, but they're big things to get initiated in.
Exactly, Chris. It's really tough to just get that discussion started. So we have our advanced directive video gets that dialogue going, and you can stop it. And there's different sections that you can decide on. Who's your decision maker? Do I want to be intubated if I needed to, or to have chest compressions? Those kind of things. And you can stop it and start over and share it with loved ones. And our tool at least gets the discussion going, because it's something we fail in the country doing, is starting that discussion before things are critical.
And being an emergency responder, walking into that living room in that situation where they're in cardiac arrest, have a terminal disease, or they're very, very ill and don't understand the potentials of either surviving the incident or not surviving the incident, in that situation is not a time to try to make those decisions. And I've experienced that myself multiple times, where you're talking to family. What did the patient want? We don't really know. We haven't talked about it. Communication is key, and that's what this whole show has been about, is communicating, understanding your health, understanding what your provider is telling you so that you can make good decisions. Not only are you involved with hospice, but you are involved in multiple entities around the Pueblo community. Tell us a little bit more about that, Tom.
Sure. We also have what we call a website widget, which has our entire video curriculum that can be put on a web page. Pueblo Community Health Center is using that. If you check out their website, patients can go there to watch those videos, so listeners can do that as well through that site. We also, in northern Colorado Springs, Integrity Urgent Care is using our product. They have a widget as well as our Engage product that's used to give discharge instructions after your urgent care visit with a clinician. Recent collaboration that I'm quite excited about is a joint center replacement education product that we're doing with Ubicare. That's UBICARE. They're a Boston-based patient engagement company, and we've combined strengths to produce what we call V-mails, or video emails, that go out to patients 6 weeks prior to surgery to 6 months after their joint replacement, and help them prep for surgery. Like, you need to quit smoking, this is what to expect, how to handle the pain and nausea, and then on into the rehab, how you have to get up and get your joint moving, and how to use assisted devices and all that. So it's been very well received in the community.
Well, it's great that you guys have come together with your backgrounds and friends. You mentioned the gentleman that is an associate that is a video producer. It's great that you've collaborated and brought a tool that is easy to use, easy to access through multiple agencies here in Pueblo, through either hospice, PCHC, and I'm sure there are other folks out there that are interested, maybe going to expand your business and be able to offer this product through other providers here in the community. But if you have questions, you can go to the PCHC website.
You can also check out our website and get sample videos there. www.incendant.com. That's INCENDANT. And that means to enlighten, and that's what we're trying to do, is to enlighten patients.
Well, it's great to have you here this morning. It's always a pleasure to work with you. We've gotten to sit on some committees together, and we see each other in passing all the time in the emergency room. And it's great to see you guys giving back to the community. Yes, it's a business, but it's a vital tool to educate the patients. And the ultimate goal really is so that you don't see them as often. You don't want them coming back and being ill and having to treat them in the emergency room in an acute situation. Again, it's your responsibility as the patient. I can't stress this enough, to really learn about your illness. If you have COPD, if you have diabetes, if you have a form of cancer, if you've had major joint replacement, there are things that you need to know and understand about your illness so that you can maximize the treatments that you're provided by your healthcare provider, and also minimize the damaging potential that they have to your body, and maybe extend your life somewhat. That's the goal, is to keep you not only just alive, but living active in the community with your families, moving around, and being the person that you were before the disease started. Take a few minutes, look at this website, talk to your healthcare provider, see if they utilize the Incendant product. And there's also other products out there, but no matter what, ask questions. Talk to your physician, talk to your healthcare providers, and find out all the details you need to know as the patient for your disease, for your illness, so that you can be a good patient and have good outcomes.
Well said, Chris. Yeah, I totally agree, and I'd encourage listeners, if you don't understand why you're on a medicine or what your disease is, ask. Let's improve our dialogue between clinicians and patients and have some improvement in shared decision making, because we want happier, healthier patients, and understanding is the way to do that.
Great to have you here this morning, Tom. This has been Heartbeat Pueblo. Again, like us on Facebook. Get updates each week as to who my guests are, what the topics are, every Saturday morning at 8 a.m. on 93.9, 100.3 FM, or 690 a.m. This has been Heartbeat Pueblo. We'll see you next week.
Auto accidents, chest pain, stroke symptoms, any medical emergency, your friends at American Medical Response are there to help 24 hours a day, 7 days a week. AMR provides emergent and non-emergent medical transport for Pueblo County, and all of southern Colorado. If you have an emergency, call 911. If you have questions, call AMR's dispatch at 545-9631. American Medical Response, there when you need us.
Sangre de Cristo Hospice is here to share the journey.
We're making it count, making the most, making a difference with our lives, giving our hearts, giving our souls, giving ourselves, and taking time to be somebody's miracle. And every day we're learning, life's all about sharing the journey. Making it count, making the most, making a difference with our lives.
Sangre de Cristo Hospice and Palliative Care, with 5 locations in southern Colorado. It's all about sharing the journey. Visit socohospice.org.
All about sharing the journey.